Hello and welcome back, esteemed audience. In today's program, we're going to dissect a paradox that many stomach ulcer patients are facing. The more places they seek treatment, the more complicated their condition seems to become, rather than improving. Have you ever found yourself in a situation where one place diagnoses mild inflammation, another concludes an HP bacterial infection, and yet another attributes the cause to stress and anxiety? You're holding 3 or 4 different prescriptions at once, ranging from acid suppressants, mucosal protective agents, HP eradicating antibiotics, to even tranquilizers. You take them week after week, month after month, but the burning sensation behind your breastbone persists, the dull ache in your epigastric region continues to torment you, and the bloating and indigestion after every meal never disappear. Your body grows increasingly fatigued, sleep becomes restless, and your mood is unsettled. Many viewers have confided in us. I've had stomach issues for 5 years, spent so much money, and still haven't recovered. Every doctor says something different, I'm so confused, or it only gets better when I take the medicine, as soon as I stop the pain comes right back. So what is the root cause of this, quote, chaotic treatment regimen? Why does treatment reach a deadlock? In this video, we will together find the answers and, more importantly, outline a path to escape the vicious cycle of hopeless treatment so you no longer have to chase prescriptions without understanding the root of the problem. Part 1. The gastric treatment maze. Why does more treatment lead to more confusion? Dear audience, please listen carefully to this part, because understanding the following points is the first step to finding a way out. First, SNAP, diagnoses based on superficial symptoms. When you visit a new clinic, the doctor usually has only a short time to assess the situation based on what you describe at that moment. Abdominal pain, heartburn, nausea. They will make a diagnosis and prescribe medication based on these acute symptoms. However, they lack a comprehensive picture. What medications have you used before? How did your body respond? Do you have a history of allergies to any ingredients? This lack of data forces them to start from scratch, leading to overlapping or non-optimized prescriptions, inadvertently creating conflicts with previous regimens. Second, the fragmentation of medical records. In our country, there is no synchronized national medical data system. This means that the 3 hospitals you visit will maintain 3 completely independent sets of records. The doctor at the 3rd facility cannot know what the treatment protocols at the first 2 places were. Our habit is to keep fragmented prescriptions, which are easily lost and often forgotten when revisiting. The consequence is that each visit is a new beginning, making diagnosis and prescription lack continuity, easily leading to errors or falling into old patterns. Third, information barriers from the patients themselves. Due to anxiety, stress, or poor memory, many patients cannot accurately and fully recount their treatment process. You might forget the names of medications, the duration of use, or the side effects experienced. Some people describe their illness subjectively, sometimes even adding details to make the situation seem more serious. When the input information is inaccurate, it is very difficult for the doctor to make a correct diagnosis. For example, if the doctor doesn't know you've been taking acid inhibitors for 2 weeks with no effect, they might very well prescribe the same type of medication again, wasting time and money. Fourth, the ulcer equals acid suppression trap. This is a classic mistake. When an ulcer is seen during endoscopy, the first reflex of many doctors is to immediately prescribe proton pump inhibitors, PPIs, like omeprazole. This can be correct, but not always. The causes of ulcers are diverse. HP bacteria, stress, side effects of pain relievers, or even stomach acid deficiency. In cases of acid deficiency, food is not properly digested, leading to stagnation, fermentation, and erosion of the mucous membrane. If acid-suppressing drugs are continued at this point, it's like putting out fire with gasoline, making bloating, slow digestion, and intestinal flora imbalance even worse. Fifth, the medication matrix, conflicts and overlaps. A stomach medication prescription often includes several groups: PPIs, acid reduction, antacids, acid neutralization, mucosal protective agents, and hydrogen phosphide eradicating antibiotics. Visiting multiple places can easily lead to these drug groups being duplicated or cancelling each other's effects. For example, PPIs require an acidic environment to work effectively, while antacids reduce acidity. Taking these 2 types too close together will reduce treatment effectiveness. Or, accidentally using 2 types of PPIs at the same time can cause excessive acid suppression, paralyzing the stomach's natural function and causing a host of digestive problems. Part 2. Alarming consequences of misdirected treatment. First, the disease becomes chronic and persistent. When we constantly change medications indiscriminately, the disease can only temporarily improve before quickly relapsing. A small ulcer initially might heal with proper care, but due to haphazard treatment and self-discontinuation of medication, the ulcer will deepen, posing a risk of bleeding or perforation. Similarly, reflux, which initially causes only mild heartburn, can progress to chronic esophagitis, leading to persistent coughing and perpetual sore throat. Second, drug dependence and impaired stomach function. Prolonged treatment for many years without clear direction will make the stomach lazy and completely dependent on medication. Many people find that symptoms return immediately after just one day of stopping medication. This is a sign that the stomach has lost its natural ability to contract and secrete fluids, causing food to digest slowly, leading to a sluggish, bloated feeling throughout the day. Third, the danger of HP antibiotic resistance. This is an extremely dangerous consequence. When prescribed medication to eradicate HP bacteria, an agent that can cause stomach cancer, if the patient prematurely abandons the treatment course, the bacteria will not be completely eliminated, but will also become smarter and drug-resistant. In subsequent treatments, the old regimen will be ineffective, necessitating stronger, more expensive antibiotics with more side effects. Fourth, overall digestive system imbalance. The overuse of antibiotics and antacids will destroy beneficial bacteria in the gut. This causes a range of disorders such as chronic diarrhea, persistent constipation, and irritable bowel syndrome. You will feel your stomach is always unsettled, have a poor appetite, and experience fatigue and weakness. This is because the nutrient absorption process has been stalled. Fifth, nervous exhaustion and anxiety disorders. The stomach and brain have a bidirectional connection called the gut-brain axis. When pain and discomfort persist, it negatively impacts the nervous system, causing insomnia, anxiety, restlessness, irritability, and memory impairment. This situation forms a vicious cycle. Stomach disease causes stress, and stress exacerbates stomach disease. Sixth, missing the golden hour for diagnosing other conditions. When we are constantly struggling with a stomachache diagnosis, we might be overlooking other dangerous conditions with similar symptoms. There have been cases where patients self-treated epigastric pain for a long time, only to discover it was pancreatic cancer, or symptoms like bloating and diarrhea turned out to be signs of chronic colitis. Misdirected treatment is not only costly, but also loses the opportunity for early intervention. Part 3. Scientific treatment pathway, escaping the maze. So how do we break this cycle? 1. Build trust with one treatment plan, one single doctor. Instead of running around, choose a reputable gastroenterology specialist clinic and consistently follow one doctor. Only by monitoring you for a long time can the doctor fully understand your medical history, adjust the treatment plan flexibly and accurately, and avoid unnecessary drug conflicts. 2. Create a personal medical logbook. This is an extremely simple but effective method. Prepare a notebook and record the date of your visit, diagnosis, medication names, dosages, and your body's reactions. Each time you revisit, bring this notebook along with all old test results and endoscopy reports. This provides the doctor with a comprehensive picture, helping to guide treatment in the right direction from the start. 3. The golden rule. Absolutely no borrowing prescriptions. Listening to acquaintances and using their prescriptions is a fatal mistake. Each person's constitution, cause, and severity of illness are completely different. Using the wrong medication is not only ineffective, but can also cause dangerous side effects, damage the liver and kidneys, and complicate the condition. 4. Identify the root culprit. Remember, the stomach is often just the victim. The real culprit could be chronic stress, causes autonomic nervous system dysfunction, leading to stomach spasms and increased acid secretion. Acid imbalance can be excess acid, but also acid deficiency. HP infection. Lifestyle and food. Habits like eating late at night, alcohol, coffee, spicy and hot foods. Work with your doctor to find the correct cause for a holistic treatment approach. 5. Establish discipline in eating and daily habits. Medication is only one part. 50% of the effectiveness comes from lifestyle. Commit to not eating within 3 hours before sleep, sitting upright for at least 30 minutes after eating, eliminating stimulants, alcohol, coffee, spicy and hot foods, prioritizing boiled, steamed, easily digestible foods, eating smaller, more frequent meals. Don't let yourself get too hungry or too full. 6. Practice relaxation, deep breathing, meditation, yoga. Stress causes stomach spasms. Dedicate 5 to 10 minutes each day to practice deep belly breathing. Deep, slow breaths will activate the parasympathetic nervous system, helping to relax the stomach's smooth muscles, regulate acid secretion, and improve digestion naturally. 7. If infected with HP, adhere strictly and thoroughly. If you test positive for HP, you must absolutely adhere to the treatment protocol, which usually lasts 10 to 14 days. Do not arbitrarily stop medication even if you feel better, as stopping halfway is the leading cause of drug resistance, making future treatment extremely difficult. Dear audience, if you have patiently followed along this far, I believe you truly want to find a way out of this persistent illness. The feeling of not eating well, sleeping restlessly, and the confusion of endless, ineffective treatment are things no one wishes for. Please do not lose heart. The problem is not that your body cannot recover, but that we have not approached it correctly. This illness requires a harmonious combination of modern medicine and changes in the patient's own lifestyle and mindset. As we have previously analysed in videos about the misconception that reflux is always due to excess acid, or the confusion between stomach pain and hidden food allergies, if you are interested in natural solutions, you can revisit our specialised topics on foods that help restore the stomach lining, or breathing exercises to reduce spasms, on our channel. Finally, thank you sincerely for your companionship. If you would like us to clarify any aspect, from the latest HP eradication protocols, specific menus for patients, to effective stress reduction methods, please do not hesitate to leave a comment below. Every contribution from you is invaluable motivation for us to create even higher quality content. We wish you steadfastness. And remember, a healthy stomach is built not just with medicine, but with your own understanding and persistent care every day.